Hello, this is Dr. Greta McLaren from Skin Secrets, and today I have a patient here with me, Meredith, and we're going to show a treatment in order to balance her face better. So we're going to use a combination of the dermal fillers called Rest and Lift that helps lift different areas. Then I'm going to use Dysport, which is the Botox alternatives. Now Dysport can last a little longer and it can actually work a little quicker. It's a really good competitor for Botox. So Meredith, if you look at her, she's fairly young. Her face really doesn't have a lot of contour to it. She still doesn't really have the cheek hollows. Some of that comes with aging. And then if you look at her from the side, her chin is recessed back. So here's her lip and here's her chin, and you'd like that to be fairly even. So what we're going to do today is we're going to put filler in here to give her a better look with her chin. Then she grinds her teeth at night, and so she's got a lot of fullness down here. Grind your teeth right now for me, and you can kind of see this muscle's real hard here. This is called the masseter muscle. So I'm going to put the Dysport, which is like Botox, right here in this muscle, and it's going to help hollow this out to make it look like she's thinner and has more of a cheek volume up here and then a hollow in here, which is what you want. Then to accentuate her even more, we're going to lift her cheeks right here. And we're going to do all of that fairly quickly, and then you can go to our website to see the before and after photos at the end, because you won't see the results of the Dysport yet. It takes about 4 to 5 days to see that result. So if you look at her cheeks, everybody's cheeks are different. You never feel two cheeks the same way, but she's very full here because she's young. There is no reason whatsoever to put filler in this part of her cheek. So relax for me. What you want to do, which will help thin her cheeks out a little bit and lift them, is you want to go along the bone right here. So I'm going to go in this area right here on one side, and then I'm going to do the same thing over here. And it will actually make her look thinner to do this. So it's pretty much just this area in here, and you'll be able to see it right away. Then in her chin, we're going to put filler in deep to the bone, and we're going to go all along here with it. And then you'll be able to see this project out more. When I'm done, this will stick out more. Then she'll have hollowing here from the Dysport. And it's just a really good advanced technique. Not everybody needs it, but we think she needs it. So I'm going to start out with the Dysport, and I'm going to have you grind your teeth down and turn this way. So open your mouth, and I'm going to feel this masseter muscle, and she's going to bite down, and you can see that it's right here. It's sticking out, and it's a round muscle right here. So I'm going to put some Dysport in 3 different places, and now I'm going to do the same thing on this side. Let's turn this way. And again, when she bites down, I'm going to put it in 3 different places, and it goes in deep. And what we just did is we put it in right here for this muscle, and it's going to shrink that muscle and give her more of a hollow. Then the next thing I'm going to do is I'm going to bring these cheeks out and lift them. This is not painful. She has no numbing. This product, Rest and Lift, definitely has some lidocaine already in it, so it kind of numbs as we go. And what I'm doing is I'm going clear to the bone, and I'm pulling out, and I'm lifting. And knowing how to do cheeks is very artistic. It's different for every patient. So a lot of patients simply don't need the filler here. They need it more medially, and they have more shadowing, but she's young. So in a young person, how old are you, Meredith?
31.
Okay. So in a young person, this is almost always where they need it. They just need it to the bone, and you want to put it right on the bone to help lift it. I don't really need those markings there. Those were just for you guys to see where I'm putting this. And if this is done correctly, it's a really natural look. And I'll finish one side of her face and show you on camera. And I lift it clear up to here, and I'm right on the bone. And I'm doing that on purpose. You can see sometimes you get a little bleeding, but it also goes away right away. And then I'm looking to see where else I want it, and I want it right here. So that's pretty easy. And so even right away, if she puts her chin down, you should be able to appreciate the lifting of this cheek. So let me take this off, and I don't need this. Again, it's just for show. So hopefully you can appreciate that that cheek is lifted, and it gives her this hollow in here, which is what we want. You want contour. In women, you want hills and valleys. You want this to stick out more, and you want this to be thinner inside. And I think you can kind of appreciate that. And if I turn it from the side, you can see how it lifts compared to this side where it just looks like all one cheek. So that's step one. Step two now, we're going to do her chin. And the chin area that you want to do on her, it's right here. She doesn't have a separation here yet because she's so young. This again is really a fairly easy place to do. I'm trying to make her chin not so much longer because she has a long face already. I'm really just trying to have it stick out more. And it'll become really obvious when I turn her to the side. A lot of times this just runs in families, you know, it's really very genetic. And I'm going to actually do 2 syringes in her because I don't think one is going to be enough to really protrude that chin. But it's very simple to do that. And that already has given her a nice look, and I'm going to still put another one in. So you can already see how when her chin is out, see how that's almost even now with her lips? It's a huge difference, and from a profile, the people that have this, especially men, but women as well, they just really like having this done. And what I'm doing here is I'm actually underneath her muscle right here. So we're not giving her a bigger chin, we're just making it come out more even with her lip. And now I'm a little deeper this time. And then when that Dysport takes effect, this will be a really pretty look on her. How you doing, Meredith?
Great.
And that looks so good. But let me come over here and finish it on this side. So I'm actually just lifting up and going under the muscle, and you can see how quickly this filler can go in. At my clinic, I actually do all my own injections. I don't have anybody else do them. I'm pretty particular about the art of it all, and so I just really enjoy it. Okay, so now, this is a huge difference on her. So now turn to the side again, and there's the difference, and now it's even with her lip. And it will make her whole face look thinner when this is done the right way. So now we only have one more thing to do, and we're gonna finish the lift on this side, and then like I say, you're gonna have to wait 4 to 5 days to really see this hollow out in here from doing those masseter muscles. But you can see how quickly this was done on her, and I think you'll think she's a thin girl anyway, but this will make her face not look so elongated. It'll actually give it more hills and valleys, and it gives it more of a feminine look. You really want light to bounce off certain focal points on your face, and that's why you want those hills and valleys. You know, you want the light to hit here and you want it to sink in here. That's why everybody uses contour makeup, to have that happen, because it's just such a pretty look when you do it. Once again, this is going to bone, but she's not really feeling it, correct? I mean, this is numb, and there's lidocaine in here, and I go all the way up to the ear in somebody this age, because she's so young. We really want a lifting effect. You can see she's not really even going to bruise with this. She'll bleed the tiniest bit, but we're pretty much done here now. So now you can see her cheeks are brought out to here, so I'm going to have her look forward like this, and now it's a really pretty look where if she were putting makeup on, she could put the darkening here, the highlighting lighter here. Her lips are just her own natural lips, and they're just really beautiful, and I just love this chin on her. So once again, this is Dr. Greta McLaren at Skin Secrets, and I just showed you an advanced technique on fillers and Dysport, and thank you for watching.